for those in the airway teams who are exclusively reserved for this PPE for those who are directly in contact with the patient and have a risk of aerosol through the patient's mouth or subsequently through a tube. So we're going to start with donning. We've decided to use the coveralls, and in the anaesthetic department first, when we get a call, we don these coveralls. Just put them on, put your shoes on, and then don overshoes. So then I've laid out the equipment that we're going to wear from left to right. So again, this is in the anaesthetic bay, in the anaesthetic department before we go to the second stage donning procedure. So we're going to start with the 3M 6800 series mask. Onto your face first, pull the straps over to the back of the head. And then have your buddy check, tighten the straps, lower straps first, tighten the upper straps. Place your palms over the aperture and inhale to test the fit. Okay, so that's a good fitting mask. Next we're going to put the hood over the mask, no stop. We're going to put this Bluetooth bone conducting headset over the ears, ensuring that the transceivers are over the zygomatic arch, because this doesn't transmit sound, it transmits vibration. Now put the hood over that. Have your buddy check your seals all the way around the rim of the mask, chin up, and buddy assist with the zip. The 3M have a bit of sticky section there. You may use a piece of tape. I don't think it's totally necessary, but it might add an extra layer, but also another complication. And then fit that up to the bottom of the mask so you have a seal, because in a normal gown your neck is exposed. Okay. The next phase is sterile surgical gloves. Ensure that they go as far up your gown as your coverall as you can. And then have your buddy, we're using surgical gowns, but if you haven't got surgical gowns, you can also use the routine gowns that you have. So have your buddy do up the Velcro or tie at the top. Undo the sterile tie and only use this one. Don't use that inner tie, otherwise you can't get it off without causing a plume. All around the side. Do it up in a single bow that's easy to undo. Next is your outer gloves. Sometimes these can be tricky to get on over your gloves, and I've found that the hand sanitizer can lubricate that. And there we have it. Now we'll go to doffing, and every step has to be interrupted by hand sanitizer. The first step is removal of the outer gloves into the bin. Sanitize. Next step is removal of the gown. So reach around and undo that single bow, and then just stretch. If you have a Velcro, you can reach around your shoulders and stretch it, or a gloved assistant can assist. Remove that carefully, slowly, inside out. You do have gloves on, but assume that you don't in case something comes loose. Put that in the imaginary bin because we're going to reuse that. And sanitize your hands. Now the next person is a buddy. Is it you've got sanitized hands, or preferably gloved hands. Place your chin up and assist, pull it out and unzip the gown. So then you carefully reach up, lift and retract, no, rip from the front, lift and retract the hood. And then grabbing shoulders, cross shoulders, carefully peel that gown down. It might be easier if you grab opposing shoulders. Can be tricky. Can't get it done. There you go. Okay, you just take your time and do it slowly. And just peel that off. The gloves will come off with it. We can do the gloves after that if you have to. I taped them before, that's probably why they came off more easily. Okay, so hold that steady. Yeah, take them off. And remember, this was under the gown, so it's not as high an exposure risk as the gown was. Grasping the inside of that, peel it off the rest of the way. Just fold your hands down your legs. No, in. And then gradually take your shoes off. You might put down a blue sheet or a towel to step on. Dump it, clean your hands. The next stage is removal of Bluetooth headset. Don't put your shoes back on. So reach up into the sky and reach over and grab the bottom of that headset, stretching out, lift it straight up. And that goes onto a table. We'll wipe this down for 2 minutes with an ISO wipe. Doffing the mask is very important because in theory this is all contaminated. So we're going to use the same procedure that the military used for the S10 respirator in their NBCD training. So what you do next is carefully flick the tabs on the lower straps to loosen them. Now run your thumbs under the straps, around the back, lean over, pull the mask off. It's counterintuitive, it's more natural to grab the mask by the chin and do that, and you'll smear your whole face with contaminant. And then carry the mask over, and put it down and we'll do a new video for cleaning. Thank you. Okay, I'm just going to go through 3M's recommended procedure for decontaminating the 6800 full face respirator. I'm informed by the hygiene section that this pre-filter is the only part that's relevant to viral transmission. The other filter is for paint applications and other vapor errors. So there are a number of other types of filters that come, such as these P2 or P3 only. This is P3, which I would recommend discarding at the end, and I'll show you how to do that. So first of all, the mask has been removed and placed into a tray, and then they come back with another set of gloves. First of all, you have to carefully remove the cartridges from the bayonet fittings. So hold it down, press in and rotate anti-clockwise, being careful not to break the lugs. Place these to one side and in a tray. We'll deal with those in a second. The first cleaning solution we have is water heated to at least 50 degrees Celsius and with, it doesn't say what kind, but with a detergent, okay? So we'll remove this expiratory port cover. Somehow, they usually came off. There we go. Dunk it in the water, dunk this in the water, swish it around, make sure that it's completely clean, and then you can rinse that off under the tap. Your second solution has got 30 mils of household bleach for 7.5 litres of water. Alternately, you may ask the cleaning staff at the theatres for bleach tablets to mix those in that solution. Fill that to 3/4. Then dunk the two components into that, make sure that they're immersed and soaked. While that's soaking, you come to your cartridges. Now, 3M tell me that this section of the cartridge can filter viral particles pretty much indefinitely. If you're using oily vapors, they say 40 hours or 1 month, but indefinitely. But that said, they leave it to the clinician to decide whether or not it's been soiled. If it has not been soiled, or if it's ended up being a negative case especially, then you can wipe the outside of it with an ISO wipe, ensuring that you have at least 2 minutes wet contact time. And then you can place them to dry or towel dry them, and then they're ready to use again. We're not particularly comfortable with that exposed surface, so we have ordered some 6035 filter cartridges that are they look like a bar of soap, and they have 4 holes on each side, and you can wipe them down. And that's what I'm told they use for pandemics in Africa. So then that's done. So you come back to the bleach solution helmet, rinse it all out under the tap, and then you can air dry it, or you can towel dry it and then leave it up to dry further, ready for the next task. Thank you. Hello, my name is Michael Ayling. I'm a specialist anaesthetist on the east coast of Australia, and I'm producing the third in a series of videos on how to use the 3M 6000 series full face respirators for those who are involved in airway management of patients with known or suspected COVID-19. I've received a lot of questions about different types of cartridges, either ones they come with, or which should people buy, or what can they get hold of, what's the best to use, how to decontaminate them, or whether they should dispose of them. So I'm going to cover as much as I can on that now. Now, of course, I'm not from 3M. This has not been reviewed by 3M. It has not therefore been necessarily endorsed by 3M, but I'm basing all my material on references provided by 3M, which are referenced with other pandemics, and provided to distributors of 3M products via 3M hygiene reps. So I'm reflecting a summary of the literature available from 3M. So in most shops in Australia, at Bunnings, you'll see the 6000 series presented like this. It's a medium, most of them are medium, some come in large, and other shops will, paint suppliers and other trades shops will provide just the respirator on its own. It might be 6800 or 6900. The package here comes with a paint vapor filter, which also has a pre-filter, which is a particulate filter for P2, and I'll show you that now. Also, it comes in a package like this, which I will be keeping in my shed for any painting or weeding or any sort of things, because I'm not going to use that. So this is the filter that the cartridge that it comes with. It's got a 6001 vapor filter, which is this side, but the white section held in with this plastic housing is the only bit that's really useful for filtering viruses. That's a P2 or P3 filter if you're using a full face mask. That can come off with some difficulty. Now, the only issues I have with this is it's not intended for use as a medical device, so that's why it's designed differently to the medical devices that I'll go into. This one's got quite a large aperture, so in theory, if you're walking around a ward that's got COVID people in it, or a train station, that's got no COVID people in it, you could, according to 3M, you could walk around pretty much indefinitely. But if you're in any risk of droplet exposure or any other kind of splash, 3M sensibly leave it up to the clinician on the day to decide whether they're soiled or not. If you are soiled with droplets and given the aperture size of this and the access to that, I would bin it. So if you get your mask in or your respirator in one of those packages and you're using it, the first time use this and then bin it and get something else. On the matter of something else, there's a lot of shortage of something else around the world. Initially, we got hold of the 2138s. This is just a P3 filter. It fits onto the side of the respirator, which I'll show you now. Just let me prepare that. So here's a respirator without any filters on it. You just get hold of this bayonet fitting in there. Now this one is only 3 evenly spaced holes. The others all have one short, one narrow, and 2 wide. Okay, so this way you place it over here, press it down while turning it until it locks. Now it's locked on. Again, it's a wide exposed surface of fabric. I would consider this single use. Now they go from between 24 to 28 Australian dollars a pair, so that's an expensive single use item if you're funding it yourself, which many people are. So we keep a supply of these as a stopgap in case the others run out. The one that 3M use for their medical filters is the 6035. They also come as a 6038, which has some what they call nuisance gas filtration, but this is the particulate filter, which is P3 standard filter, 6035. They are quite, there's a lot of shortage of it at the moment, and some gougers in the UK in particular are trying to ask £110 for one pair. You can get them for 10 packs of 10 pairs. Usually the retail will be between $210 to $250. Some people are selling them for up to $400, which you know, depending on the urgency and available funds, may be okay for you, but they're not very easy to get hold of, and there's a worldwide shortage. This is what they call their pandemic or their medical filter. And you can see close up, there's a plastic housing completely covering the filter. Inside is a HEPA filter, or a bit like an HME, and the inhaled gas goes in the sides, around, and then out here. So this is reusable, according to 3M, for quote unquote the duration of a pandemic wave. The duration of a pandemic wave. So how long does a pandemic wave go for? Well, it depends, and probably doesn't really matter. The information given by 3M is that these filters are designed to be used within an extremely polluted industrial environment, and that the primary indication of when you should change a filter is if it's difficult to breathe. The rep has told my sales representative that it is extremely unlikely in a medical situation to encounter that degree of particulate pollution from viruses or bacteria or whatever else is in the air. So in theory, they could filter almost indefinitely. So they just say when you've finished your pandemic deployment or operation, then to chuck it out. So and I'll show you how these go on. If you look quite carefully there's one narrow and two wide lugs. Match them up with the lugs on the respirator. So here we go, narrow to narrow, wide to wide. Press firmly and twist gently with firm pressure until it locks into place, like that. We'll place the other one on. And pressing, gentle, 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 locks. Okay, then it looks like that. It's actually much lighter than the other filters, than these ones, and you can use them for months in theory. So what we've decided to do in order to clean them, we don't have any radiation sterilisation facilities in our hospital. I don't know of any that do, but I don't get the impression from what I've read that is necessary. So when we're decontaminating the respirator after a case, we remove those, clean the respirator as per my other cleaning video, and we're going to wipe these down with an antimicrobial solution. Now, I would argue that isopropyl alcohol would be appropriate because it's only for a short duration, because it can over time degrade various plastics and polymers. Alternatively, you may be able to use antimicrobial wipes such as Clinell, the green bag wipes, that can kill norovirus, which will remain active for 10 days on hard surfaces, whereas the SARS-CoV-2 virus will only remain active on hard surfaces like plastic for up to 72 hours, according to a recent Lancet publication. So clean them all up. Probably I would think it'd be a good idea to point it down so that gravity stops any moisture from getting into the filter, and then dry them off or air dry them, and then keep them in a bag till the next time, or if you have your own respirator, keep them on the respirator till the next time. So that's it, that's what I've got. If you can find them, good luck, and please don't hoard them. Just get as many as you need, with a couple or 2 or 3 in reserve, and hopefully we can have a good solution until we get more definitive equipment such as PAPA respirators. Okay, that's it. Thank you.